What we're looking at then with the stalk test, just as a recap, is as the hip moves into flexion, we are looking for not just ball and socket joint movement, but also sacroiliac joint movement. We want the ilium to move independently, kind of said loosely, to the sacrum. So as that comes up, we need that sacrum to be pushing back without the movement of the sacrum coming with it. So with that in mind, if you stay in your trainers, Andy,
Yeah.
if you come and stand just there for me, please. Good. And face that way. Perfect. I'm going to tuck this into your bra, okay?
Yeah, that's fine.
So you can see what's going on here. So what butcher has got hold of you today? Stay there. Find the PSIS, that's the first thing to do. PSIS just there, and then if we're looking at the right side, the left thumb's going to come onto the sacrum, because that's our waypoint. That's going to stay where it is, as this one gets pushed down by the posterior superior spine PSIS. That'll make more sense when you see it in action. So, clear instruction needed for the patient. I'd like you to stand on your left leg, please, Andy. Bring your right knee up into your chest and hug it in with your arms. Good, we're looking for that. There you go. You can see the thumb move down, and watch as the leg comes back down, the thumb should move up. So come down, they're level again. Okay, probably not as much movement there as I would have liked. The more people you do it on, the more you'll know what's normal, what's not. As always, let's compare it to this side. So find the PSIS, make sure you're definitely on it. Right thumb on the sacrum, level. This time stand on your right leg, bring your left knee up, hug it in, good, and then back down. I'd say there's equal movement there both sides. I would encourage you to do that before you do the treatment, the cupping technique, because we're going to treat the side that is restricted. If it's restricted, there won't be much movement in this thumb at all, and it's usually on the way down, the leg coming back down, you really feel that thumb start to come up. So just keep them out for that. If you need any pointers, grab them, and we'll have a look at a few different people. Right, let's have a look at the mobilisation then. So we'll pretend that it is restricted. If you put the shoes off, please, Andy. And if you can face me this way. And on your side.
Okay.
And I need you to shuffle all the way over to me on this side of the couch, please. Straight legs. Good. A little bit further. You won't fall off. Promise. So make sure you've got the towel tucked in. The mobilisation that we're going to do, I won't spend as much time on this as I might otherwise. We're going to bring this knee up. So we're basically replicating that stalk test, knee or hip into flexion. And then what we're looking for is movement, that ilium, to come away from the sacrum as we do so. So as this knee comes up, the ilium should move in that direction. If it wasn't, then we might be able to make a difference in that with this kind of mobilisation.
I do remember doing that.
Yeah, I was just thinking.
Yeah.
Good. So as the hand wrapped around the ilium, like this, the forearm just trailing down towards the coccyx, and then a combination of my legs bringing Andy's hip into flexion, as well as my forearm bringing the ischium, everything else this way, to give us that movement, ilium and sacrum. So bring your leg back down, good, hand on the couch so you definitely don't fall off. So that's a great mobilisation in itself. You can apply METs, that does lots of different things with it. But the cupping aspect, because we're looking to make a change on that joint, I think reads differently depending on where you see it, but we're looking for about 4 degrees of movement in the sacroiliac joint on the flexion. You can see, in my experience, what looks like more than 4 degrees of movement. So there is a visual on there. You can see that even clearer with the cups. So for the cups, we're finding the PSIS. Cup underneath that, just below onto the sacrum. 2 pumps, is it okay?
Yep, fine.
And then the other one is going to go diagonally in this direction. So we need the PSIS in between those 2 cups. Just about there. So now, as we start to move that hip, these 2 are going to pull apart. That's what we're looking for. And they're going to help to stretch the sacroiliac ligament and any soft tissue in this area. And I can feel that stretch in between the cups as well. So let's start again. Knee into your hip crease. Hand around iliac crest. We're aiming to pull the ilium down as we flex the hip.
All passive.
All passive, yeah. And that's basically it. It's just like the sacroiliac joint mobilisation, but just without cups. That's all it is. So it doesn't take much to add a couple of cups while you're in this position and to go for it. To see, look at the visual as well, the cups moving away from each other, what's happening there.